And we should also share the screen and start from the beginning, from the first slide. So as you see here, we continue speaking about explaining and reassuring the patient. And before this, we need to just focus on some sentences that were given to you as home assignment. And so as I see, only a few students got maximum score for this task because there were just some mistakes in these sentences. So we should just focus on some details here to be sure that we understand everything. The most difficult sentence for us was the first one, which is given here first on this slide. And so as you remember, the task was to use the verbs in the active voice or passive voice in the present simple or past simple tense. So now let's listen to Aman. Will you read the first sentence and say the correct form of the verb here? Aman. Aman? Hello.
Yes, ma'am. Yes, ma'am.
Yes.
The park gates are locked at 6:30 p.m. every evening.
Okay,
Ma'am,
so
second. Okay.
is it active or passive?
Ma'am, it is active voice. Are locked.
Are locked.
The gates are being.
No.
Yeah.
It's passive voice. Yes, it consists of two
No?
parts. The verb to be in the form of are
Okay.
and locked. Yes, are locked. Okay.
Okay.
Well,
Okay, ma'am.
because some of the students missed the verb to be or just the park gates locked. This is wrong because the park gates can do anything themselves. It's not a human being, okay? Passive voice should be used here. So Apeksha, the second sentence is for you, please.
Yes, ma'am. Why dash from her job didn't she enjoy? Why did she sue? No, why did she resign from her job? Didn't she enjoy it?
Yes, she did it herself. That is why we use active or passive.
Active.
Active voice, yeah. And in the next sentence is for Misha.
Yes, ma'am. Why from this job did he do something wrong? Why was he fired from his job? Did he do something wrong?
Yes, so here, is it active or passive?
Active.
No. It's, you say, why was Ben fired? So it's passive voice.
Yeah,
He did,
passive.
yes, he didn't do it himself. His supervisor, just his boss, fired him. Why was Ben fired? Okay, Nivas, please, the next sentence.
Yes, ma'am. Where were these photographs taken? In London. Did you take them?
I missed. What did you say in the first part of this statement?
Where were these pictures taken?
Where were? Yes, passive voice. And then did you take
Passive voice.
active? Okay, good.
Yes,
So Vandana, please.
Yes, ma'am. The boat hit the rock and sank quickly. Fortunately, everybody was rescued.
Exactly. Now you're right. Okay. Well, Priyesh, no, Rakhav, are you here? Rakhav? No, Rakhav. Rakhav is absent. Ujjwal? No, Ujjwal. Sayonika? Sayonika?
Yes, ma'am.
So please about
Yes, ma'am.
camera.
While I was on holiday, my camera was stolen from my hotel room.
Yes, something did it with my camera. That is why we use passive voice here. Mhm. And the next sentence is for Rohit.
Yes, ma'am. The letter was sent a week ago and it arrived yesterday.
Mhm. So
So
first
it was
we have
It's
passive
passive.
and then
Yes, ma'am.
active. Yes, it arrived. So, okay, so this is the way we should have used this active and passive voice in the sentences. And I would also like to say some words about your essays that you've written. It was very interesting to read the essays for me. Just I've got a lot of information from your essays about so how you feel studying at our university and about some differences in culture, in the language. That was very interesting for me. And it's also good that you've done some research about our university, that so you've found the information about so the facilities, about the teachers and the history of university also. So thank you very much for your essays. I think we will just publish some of the essays in our newspaper. So I just need to choose some of them, okay? Well, and yes. Well, good. Now let's go on. And today we are going to just go back to the doctor that we listened to at the previous class. You remember this picture? The doctor was talking to his patient. Does anyone remember his name, the name of the doctor?
Dr. Quinn.
Dr. Quinn. Yes, right, Dr. Quinn. And so we'll focus on how the doctor reassures his patients. You understand that reassure means to say or do something to remove the patient's doubts and fears. And so in the conversation, the doctor used two adjectives to help this procedure, which was gastroscopy, less frightening and to the patient, and thus to reassure the patient. And the example of such sentences are given here. Examples: the tube will have a tiny camera, or it's a routine procedure. So tiny and routine are adjectives that just show the patient that the procedure will be easy. And let us have a look at the sentences here and comment whether they are reassuring or not reassuring. Okay, so please Ritik, will you read the first sentence?
Yes, ma'am. It is a very simple procedure. It is reassuring because doctor tells the patient for a operation to be successful, and he or she will convince her to be a simple procedure.
Yes, so
The patient not to be frightened or somebody wants nervous.
exactly. And so the formal way of showing just of making the patient feel confident is simple. The doctor uses this word simple. Just
Yes, ma'am.
okay.
Simple.
So Mohammad, what about the second sentence?
Ma'am, we are just going to take some fluid from your backbone. So, ma'am,
Is it
ma'am,
reassuring?
yeah, ma'am.
Okay, so what helps this sentence to sound more reassuring?
Ma'am, we are just going. Like, ma'am,
Just
just show, ma'am, that like it's a normal procedure,
okay.
not a big thing. Yeah, something like that.
And And also backbone is shown in the picture
Yes,
to
ma'am.
the right. So what are the other words to describe this part of body? What is
Ma'am,
it?
ma'am, what?
So the picture, what does the picture show?
Ma'am, the picture show the backbone, and ma'am, it covers covers or protect our spinal cord. So, ma'am, the doctors just taking some spinal fluid. Ma'am,
I
like
see. Okay.
they're going to taking some spinal fluid.
Mhm. Okay. Now, please, Aman, sentence number
Yes,
3
ma'am.
is for you.
You just feel slightly sore after the test.
So,
Ma'am, it is not very reassuring because
why?
you just feel slightly sure.
How can you
So
make sound
no,
more
no,
reassuring?
it's assuring. It's
Yes.
reassuring because yeah, it's reassuring because the doctor is saying that you'll just feel the
Yes.
intensity might be the low, but you will definitely feel the soreness of the test, like
Okay.
the soreness after the test.
Yes, but we are speaking about the formal structure of the sentence, and you see that the doctor uses just and slightly.
Yeah.
Yes, just to show that it's not very serious. Okay. So, Apeksha,
Okay.
please, the next sentence.
Yes, ma'am. All you'll feel is a tiny scratch, nothing more. This is a reassuring sentence.
Because of tiny, the adjective.
Tiny and nothing more is also
Yes,
kind of assuring.
exactly. Okay. So, Misha, please.
It will take 10 minutes. It's a reassuring, I think, because the doctor is specifically saying that it will take 10 minutes. 10.
Can we change the sentence to sound
It will
more?
just take 10 minutes.
It will just take yes. If we add just, it will be better. Okay. Now, Nivas, please.
Yes, ma'am. It only takes a few minutes. Here, it is assuring that the procedure is not as long as much.
Okay.
It
Okay.
just
Good. So, Vandana, please, the next sentence.
Yes, ma'am. It's not a pleasant procedure.
So,
It's not reassuring type.
and how can we change it to make to sound it more reassuring?
It's a pleasant procedure.
Really? So, I mean, should we lie to a patient that this is a pleasant procedure? So
No,
some
no,
people,
ma'am. Ma'am, you asked. Okay, okay. I got it wrong.
I mean,
Ma'am, a
how can we
pleasant
change?
procedure means what?
Apeksha, I'm answering.
Okay.
It's my
I am
turn.
just asking a question. I'm
It's
not.
my turn.
So let us listen to Vandana. Yes.
Yeah.
Ma'am, it's about the answering the patient in a different way. It can be it's just a little bit complicated or something like that.
Okay. Yes. Yes. Just you add the adjective, just the phrase a little bit, just
Yes.
to
Ma'am,
reassure the
I have a.
patient. Okay. Good.
Yes,
Apeksha
ma'am.
would also like to add something. Yes, Apeksha?
No, I'm not.
No,
I
I
don't want to
see.
add. I just want to ask. Pleasant procedure means what does the doctor want to say? Whether it's a complicated or whether it's a smelly procedure, what exactly does the doctor want to say?
It depends on on what the doctor wants to say, right?
So how can we tell it to a doctor in like if we are not sure by ourselves that this is what the doctor wants to say? Like if I say it is a complicated procedure, then that may contradict. So I'm not sure what to answer here.
Mhm. Okay, anyway, pleasant means something that gives you pleasure and makes you happy, right? And if we just
Maybe it will cause uncomfortableness or something like that.
Yes.
That's why it is not very pleasant.
So that is why we should just say something to just calm the patient down, okay? To make to comfort him. Okay, and now let us listen to.
We can use like a bad or also some
We can
words
use
like
what?
it's not ma'am, it's not a bad procedure or like it's not a offensive procedure.
Okay, Yes.
Ma'am, in place of pleasant.
Or common procedures we usually.
Yeah, ma'am, common
do.
procedure.
Mhm. Well, Rakhav, please. Rakhav? No Rakhav? No Ujval? Sayunika?
You'll hardly feel anything. The doctor is reassuring the patient that he won't feel
Mhm.
much, which making the patient more comfortable that there will be not pain.
Okay. Okay, right. Well, if we move to the next slide here, let us listen to the same statements, how the statements are pronounced by different doctors. And so you can see that we can also reassure the patient using the emphasis. I mean, stressing some words in the sentences. Like in a row of the words, we just pronounce one of them, we emphasize one of them, and it sounds just encouraging and comforting. Now, let's listen, and you'll tell me then which word is stressed in each of the sentence.
Listening 3. 1. Listening 3.
Can you hear?
1.
Yes,
Listening
ma'am.
3.
Yes,
Okay.
ma'am.
1. It's a very simple procedure. 2.
We're just going to take some fluid from your backbone.
3.
You'll just feel slightly sore after the test.
4.
All you'll feel is a tiny scratch, nothing more.
5.
It'll take 10 minutes.
6.
It only takes a few minutes.
7.
It's not a pleasant procedure.
8.
You'll hardly feel anything.
Okay, in the first sentence, which word is emphasized?
Very
Ma'am,
simple.
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 Very simple. Simple.
It's a very simple
Simple.
procedure. Yes. In the second,
Ma'am, just.
Just
Just going.
in sentence number 3,
slightly.
Ma'am, just.
slightly.
Just slightly.
Mhm.
Slightly.
In number 4,
Ma'am,
Tiny.
tiny.
Tiny
tiny,
scratch.
tiny scratch.
Tiny.
In sentence number 5,
10.
10.
10 minutes. The doctor emphasizes that it will take short period of time, 10 minutes, and the stress just make the patient just encourages the patient. And number 6,
Sure.
number
Only.
6,
Ma'am, only take.
Only and few.
number 7,
Ma'am,
Pleasant.
not a
Pleasant.
pleasant. Pleasant. The doctor emphasizes, stresses pleasant. And in number 8,
Hardly.
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 or anything. Yes, anything and hardly. Okay, so this is the way to sound more confident. And so there were also other ways. There are also other ways to how to explain the steps of the procedure. It can be done with the help of the future form be go into. Doctors need to explain procedures before they perform them, so that they can obtain patient consent. And the future with the be go into is usually used to explain a procedure, even when the patient hasn't yet agreed to the procedure or given consent. To be go into future is used because it is the clearest and most direct way to give an explanation. And when the procedure is fully explained, the patient can give informed consent. So the consent when he knows everything about the procedure. And the example with the use of be going to is given here on this slide. We are going to give you a mild sedative. We are going to give you, okay? And there is one more way. In addition to using the be going to future, doctors often use fixed expressions with what to explain procedures. Now let us focus on the examples. So they say, what we are going to do is take a tiny sample from your scalp. So pay attention to the phrase that we need the verb is. And in the second example, what happens then is we are going to give you a mild sedative. And then what happens next is that we insert the needle. And what we need to do after that is stitch the wound. Well, and now let us look at the sentences here, which explain the procedure to a patient, and let us change the explanations to be going to. Maybe we can also simplify the medical terms. And where indicated, we should use an expression with what. As you see, the end of some of the sentences, what is given in brackets, okay? Now let us listen to Ritik. The first sentence is for you. Ritik.
Yes, ma'am. A sample is taken from the bowl.
So change it, please. Use going to. Ritik. So can we use active voice instead of passive here?
Yes, ma'am.
So what do you tell your patient? So you say we are going to.
We are going to take a sample from the bowl.
Exactly. Okay. Or instead of
Ma'am,
sample.
can we?
Yes.
Ma'am, can we write it as like what sample is going to be taken from the ball?
A sample is going to be taken from the bowl.
What sample is going to be
No.
taken from the ball?
No,
Not?
you are asking a question.
The meaning should
Okay,
not
okay, ma'am.
change.
Okay,
So,
ma'am. Okay.
Yes, I should think what we are going to do. We are going to take a sample from the bowl. So this is the way we can
Okay.
use what. Okay.
Okay,
So
okay, thank you.
Muhammad, please, the next sentence.
Ma'am, next the end of intestine is attached to an opening of the abdomen. So ma'am, the sentence is like what happened next, the end of the intestine is going to attached, is attached to open on the abdomen.
Can you change into active voice?
Ma'am, like ma'am, we write like what happened next, the end of the intestine is attached to an open on the abdomen. Ma'am, we use what happened.
This is passive.
Ma'am, we can also tell what we are going to do is attach the opening of the abdomen to the end of the intestines.
Yes, ma'am.
Yeah, ma'am. What we are going to do.
What we are going to do is attach the end of the intestines. Okay. Next is for whom? For Aman. Aman?
Yes, ma'am. Yes, ma'am.
Number
Sample
3.
is taken from the cervix.
Use going
What a
to.
sample. A sample is going to. A sample is going to be taken from the cervix.
Or if it is an active voice, we are going to.
We are going to take a sample. We are going to take a sample from the cervix.
Okay. So the next is for Apeksha.
Yes, ma'am. After that, the tube is passed through the urethra. What we are going to do next is pass a tube from the urethra.
Exactly. Good. Misha, please.
The glands are then removed from the axilla. What we are going to do is we are going to remove the
we are going to remove the glands.
We are going to remove the glands from the axilla.
Good. Well, next is for Nivas.
Yes, ma'am. Next, a sample is removed from the lung. So correct answer is what we are going to next is we will cut a piece of tissue from the lungs and send it for further diagnosis. For example, we
Exactly.
have biopsy,
Mhm.
lungs biopsy.
It's better not to use such a technical term when you talk to a patient, but about tissue, it's very good. Mhm. Well, the
Amen.
next is for Vandana.
Yes, ma'am. Next, a sample is removed from the lung. What we are going to do next is remove a sample from the lung.
What about number 7?
After that, a tube is advanced down past the prostate into the bladder. What we are going to do next is pass a tube or advance a tube down the prostate into the bladder.
Exactly, very good. Thank you. So the next is, what is the next? Sayonika.
Yes, ma'am. A dye is then injected into the pancreatic and bile ducts to visualize them. What we are going to do, we are going to, like, a dye is going to be injected into the pancreatic and bile ducts to visualize them.
Okay, or what we are going to do is to inject a dye. Yes. Well, and so Rohit.
Yes, ma'am. The muscle is being repaired with a mesh. The muscle is being repaired with a mesh.
Is going to be repaired,
going,
right? It's going to be repaired with a mesh. So, and the mesh is illustrated here in the picture. Okay, and now, so what we are going to do is to explain the procedures, to give a short explanation of procedures to a patient using the expressions which are given here on this slide, at the top of the slide. So a condition where, an illness where, a procedure where, a device which you used to, and you see that here we see the situations where and which, and the example, anemia, not enough pigment in the blood, and we should just
the condition.
It's given here. Yeah, it is a condition where you do not have enough of a special pigment or coloring in your blood, and there are 6 just conditions or procedures given here. Let us try to use these phrases in the just explanation, giving a brief explanation to a patient. Well, who is the next? Let it be Muhammad.
Yes, ma'am.
The first one.
Ma'am, the first sentence is like, ma'am, appendices is a procedure where we removed such inflamed tissue. Ma'am, we use tissue, which.
Okay. Okay. Yes. Now I understand what it means. Aman, please. Number 2.
Yes, ma'am. Alzheimer disease is a condition in which someone loses the memory, and with mood swings or mood changes, which could someone lost the memory and mood changes, and the cause is not known yet.
Okay. Yes. Now I can understand what it means. So, Apeksha, number 3, please.
Yes, ma'am. Hemorrhoidectomy is a procedure where the piles are tied and cut out.
I see. Okay. Tied and cut out. Okay. Misha, number 4.
Yes, ma'am. Diverticulitis is a condition in which where there is an infection in the colon and causes inflammation and pain, and it also causes diarrhea and constipation.
Okay. Let it be.
It is
Then.
a bowel dysfunction.
Okay. The next is for Nivas,
Which one? Fifth or sixth?
number
Fifth one.
5.
Okay, ma'am. Sigmoidoscopy is like a procedure in which trained professional uses a like a flexible narrow tube with a light and tiny camera on one end, and that is called as sigmoidoscope, or we can say that scope, to look inside the rectum of patient or lower colon and
Mhm.
diagnose further.
I see. Okay. And and Vandana.
Yes, ma'am. Anesthesia is a general condition where you're put to sleep and then come around.
Mhm. Okay, during surgery, right?
Yes, ma'am.
Normally. Mhm. Okay,
Yes.
thank you. Well, so yes, it looks like we have about 1 minute left, and so it doesn't make any sense to deal with the next slide. So